In practice, most frequently what you're going to see are volume control modes. And in subsequent videos, I want to delve deeper into settings and modes that fall under the heading of volume ventilation modes. But for right now, let's focus on some primary advantages and disadvantages to volume control ventilation. The primary advantage to choosing a volume mode of ventilation is that we can regulate tidal volume and minute ventilation. Tidal volume is the amount of air that is given to the patient with each breath. Minute ventilation is the parameter that you get when you take tidal volume and multiply that times respiratory rate. This is a very good indicator of ventilation or CO2 removal. So having complete control over minute ventilation is an awesome advantage to using volume control ventilation when our primary goal is CO2 removal as opposed to oxygenation.